Good afternoon. I'd like to welcome everyone to this week's Belonging interview. It's a candid series of interviews hosted by Imperial as one, where we look at the BAME experiences. And this week, I'm really pleased to welcome Sarah Adansi, who is going to be here with us. And she's a mental health nurse specialist. And so this week, she's going to give us some insight into what it's like to be a mental health nurse, but also her experiences, the challenges and the joys and pains which are there for when you work with mental health people, etc. Guys, let me start that again, all right? It's been a bit of a rush. Basically, Sarah's here and she's going to have a nice discussion with us with regards to her experiences as a mental health nurse, but more than just as a mental health nurse, okay? So, Sarah, sorry for the poor introduction. It's been a bit hectic, but let's see what we can do. Sarah, let's kick off by asking that question. What is it that has motivated you? Give us a little bit of an idea about your early years, your background, and what's brought you to the position that we're in now.
Okay. Well, first of all, I just want to say thank you for inviting me. I'm really, really pleased on your show to talk about mental health as a mental health specialist. And obviously tomorrow's Mental Health Day. So this is just prime time and it's just something that I've loved. So I'm a 46-year-old lady, born in London, Wembley side, Royal Park Hospital, Brent. Moved over to the Luton end in my teens. My parents are, my dad was African, Ghanaian, and my mum is Liberian, West African heritage. But I grew up in a home with my mum and my stepdad, who was at the time Barbadian. And so my culture is kind of mixed, you know. So a lot of people don't really put me into a box.
Yeah.
But I'm multicultural, and that's the box I like to tick.
Yeah.
So I came into mental health. I always knew I wanted to work in the caring industry. Mm-hmm. That's my nature, it's my personality. It is, you know, if anybody knows me, they know that is exactly my forte. I love people. I love socializing. I like to get to know people. Mm-hmm. I'm intrigued by what everybody's story is, and how they are who they are. I enjoy diversity. I enjoy learning new things, new cultures, and I'm nosy. You'll find a lot of people in the either caring industry, social work industry, they're just inquisitive. Right. In a positive way. And so putting those two things together brought me into mental health. I started as a support worker back in 1993, working with people with challenging behavior, their mental health, and found that I actually like it. I like the fact that not any one day is the same. I love the fact of getting to know somebody, getting through those onion layers, the layers that make and construct that person. And so, you know, obviously it then led me into the nursing field in mental health nursing, which is something that I'm old now, but, you know, I am as passionate now for it as I was when I was a youngster. And I would say more so, I love the job that I do. I love people, and I love making a difference to people. Even sometimes it's just a little conversation, just saying that hello, but it's how you say that hello. And it's not just, are you all right? Oh, how's your day? You know, but going a little bit deeper. And sometimes that can save somebody. So that's what I love.
Yeah, just going back. So you were born in London, grew up in London for the majority, and then came across over into the Luton area and everything like that. Schooling, and I'm still trying to work out where that link from being naturally inquisitive about people, and where you go from that inquisitiveness about people and that desire to know people to that link across then to actually working with people with such special complex needs.
Mm.
Where did that come from?
I was lucky enough to have good friends around me. And so when we were young, things like 11, 12, 13, and there would be a fight in the school playground, there would be, oh, look, here comes Oprah Winfrey, because I was always the one that was going to resolve it. Let's talk through it. There's a way of, getting, resolving this situation that it didn't have to come to fights. I mean, I grew up in Harsden area.
Yeah.
And so, those were quite common. But that's when it started to like me. Actually, I do enjoy this. I do enjoy resolving these kind of conflicts and issues. And then I had a great careers meeting where the teacher said to me, she was able to see my qualities and was able to say, actually, this is the direction that maybe you might like to explore further. And so, in fact, they were pushing me towards social work.
Right.
Um,
Okay.
and it was just a part-time job I had at the time in the caring bit, in the mental health. It was a small mental health nursing home, and that's when I thought, oh, actually, I like this way, and then I swayed into the mental health.
Okay. Okay. Because I I don't know. I suppose, based on media depictions of mental health, right? Mental health does get what I would class as a negative press. Yeah, it's kind of like people who can't control themselves and etc. And you always seem to see the worst side of mental health, right? Can you give us an example of a kind of like a how you help somebody transition through maybe a crisis or something, and the reward that you get from that process, if you've got one, a kind of example?
Loads.
Right.
Yes, loads. I mean, yes, the media, firstly, the media only sees the superficial part of a person. They only report on that. They don't report on the person's background, because, they don't go through, because, everybody's got a story.
Yeah.
And once you understand the story, you understand the person, and
Right.
actually you understand and appreciate why they've ended up where they've ended up.
That's
So
right.
let's take one of my guys who was picked up by the police. And the first time I saw him, he was naked in the back of a police station. In the back of a police cell, sorry, and he was brought into our mental health services for an assessment. So they arrested him, placed him on 136, and brought him into hospital to be assessed, because they were worried about his mental health. And so where we get from that person would come out, and actually they had been, after a long conversation, we understand that you give the person time to settle, maybe sleep it off, and then you assess the person, because sometimes they're not appropriate to be assessed or spoken to straight away.
Yeah.
And so you give that person the time to sleep it off, and then once they wake up, they're like, how did I get here?
Yeah.
And then you find out they've been out on a night out. Somebody gave them something as an experimental drug. They took it, and that's the last they remember. And they've ended up, they don't even know where the clothes is. They've ended up being placed on a 136, and we get a doctor in, two mental health professionals to come and assess that person. And at that time, have a long conversation about, this could have been worse. You could have actually committed a crime, and maybe you should pick your friends or that particular drug. And we were able to test the urine and maybe signpost them and saying, this is what was in that drug, and you really should refrain from doing that, because next time it could be worse. We would then, at that time, if they're not needing the service any further because they've slept it off, the drugs come out of their system, we can then discharge that person back to their home. But sometimes some people, it takes a little bit longer. And so they could be, if they're willing to accept help, they'll come onto the ward and stay a few days until it's all out of their system. And other times, if they're not willing to accept that help, then we would have to section them. And this is the worst case scenario, to be honest with you, because it just means that that person is still under the influence, is not willing or accepting of help. But luckily, in the case that I'm giving you, the person accepted it and they were actually discharged straight
Fantastic.
away once, because it came out of their system. And they were discharged, and I hadn't seen that person back again. But young people often experiment with drugs, go on night out, sometimes drinks a spike, you know, and these things can result in ended up in a mental health sector.
Yeah, that's you mentioned earlier a couple of things. You said about this 136. Could you explain what that 136 is?
Yes, so basically, if the police are out and I'm sure people have seen people maybe shouting or behaving in a peculiar way, the police have it's an arrest, but really if they arrest them to take them to a place of safety. And this is where they take them. Usually they try not to take them into a police cell because it's for a medical reason. So
Right.
either, you know, they'll take them to A&E, or we've also got a 136 suite, which is not exactly on the ward, but nearby. And, you know, the police will stay there, or sometimes they would leave the patient there, and we would get a doctor and some professionals to come and assess that person. And the assessment process is about talking to that person and establishing what's ended up how they've ended up, you know, being arrested. And sometimes we could either discharge them off that section totally, or we can offer them an informal, which is an informal admission means you come in of your own wish to be treated or assessed and treated. And if they decide they don't want either, but we are very concerned, and it would only be done when we are very concerned that if that person left that building at that time, they would be a danger, one, to themselves or to others. Those are the only times that we then use detention order.
Yeah.
And this is a very powerful detention order, because there's nowhere in the UK where you can just on that same day, at that same moment, the doctor and professionals can sign a piece of paper with an assessment attached to it to detain that person either for 28 days or 6 months. And that's one, the 28 days is a section 2, and the 6 months is a section 3. And you can move from a 28 days to a section 3, which would be 6 months, you know. So it's the most powerful thing. You know, even in the court, even the police haven't got anything that they can hold you, you know, theirs is 12 hours and things like that, you know, but ours, 28 days, you could be held. And that will be on even when you're discharged after that. Do you know people can't travel to places like America once they've been mentally detained and detained under the mental health? You know, so it affects you. Sometimes it'll be 10 years later, and then that record will come back and they'll refuse visa entry because of that.
So tell me, how do you cope? How do you cope seeing these kinds of, I'm just thinking about in terms of the sense of belonging, where you see these people almost feel disconnected from their environment because of the mental state they find themselves in. How do you cope with dealing with these type of people on a day-to-day basis? Where's your support? Where do you get your balance from?
So this is why it's really important to be grounded in yourself.
Yeah.
Because you got to know you. You got to know where your mental health is at, you know. You've got to be strong in yourself and actually have good, I always call it soothing techniques, because everybody suffers from stress. You know, I always say, if you've got a brain, you have a mental health issue. It's not these people, it's anybody. You know, because any one time in our lives, we can always, you know, stresses and lifestyle and bringing up PTSD, being trauma from your color, trauma from your peers treating you a certain way, trauma from school, trauma from your family. Anything can end you up having a mental health issue. And so for the simple fact that I appreciate that and I'm aware of myself, that's my first grounding. But family is another grounding, you know, self-soothing. you know, I'm very good at mindfulness. So
Yeah.
knowing yourself, knowing what helps you. But what helps me most of all is knowing that I'm making a difference.
Right.
That's what keeps me going. That's why I go back time after time. Sometimes, you can't win them all.
Yeah.
And not everybody's going to like you.
Hmm.
But, you will make a bond with somebody. You will make a bond with a majority of people, because when you are genuine, people are attracted to you.
Yeah.
When you're honest, when you're kind from the depth of your heart, not when you're
Yeah.
just doing an interview and you're just saying it. People see fake, they see through fakeness.
Yeah.
And so when you are a caring person of nature, it's your upbringing, it's your personality, they'll see through that. And that's what keeps me going.
Yeah.
Obviously, you've got your supervision, your appraisals and things like that.
Yeah.
But really, those are paper exercises. That's not what keeps me going.
Hmm.
Keeps me going is the job that I do, and doing the job that I like to do and love and appreciate doing.
Fantastic. Fantastic. I'm going to ask you about, because I hear what you're saying. You've got your self-soothing techniques. Your family is very important, and knowing yourself, knowing who you are, so that you're able to recognize any triggers which may say, well, you know what, if I carry on down this path,
Yeah.
it's going to be detrimental to me. Yeah, right. But how do you overcome your own then personal challenges? What personal challenges have you faced, either in your job or elsewhere, which have kind of like almost pushed you down that course? Is there anything like that? And how have you overcome that?
So the nature of me is that the glass is always half full,
Right.
it's never
Okay.
half empty. And
Right.
so it's only when you come through it that you will know it's the challenge, because a lot of people don't recognize it straight away.
Yeah.
I'm a privileged kind of person that I never frontline face racism, because where I lived was majoritarily Black. And
Yeah.
so moving to Luton, being Black was actually fashionable. And so, it was the in thing,
Yeah.
everybody wanted to be with the cool kids. But obviously, I have faced racism, but it's only now, at that time when you were young, you didn't know when the teacher was being a funny kind of way. You
Hmm.
didn't know when the bus driver wasn't being appropriate because you're too young.
Hmm.
You didn't know when the train driver was only questioning you, or
Hmm.
I didn't know when I went to, I think it was Washington D.C. at the age of 18, and they questioned me for an hour and a half on how I came across my passport,
Hmm.
and made me put my hair back so that they could examine the passport in the picture properly. I
Yeah.
didn't recognize it then because I wasn't exposed to it.
Yeah.
You weren't woke,
Yeah.
and so now we are woke, and now
Yeah.
we know, hold on, this this was not right. you
Yeah.
know this this is not okay. But I'm a positive person, and so I thought sometimes I was a bit naive and didn't know and understand it fully. And
Hmm.
it's weird because, you know, that ignorance at that time maybe saved me, because, if you knew and recognized it, it would affect you more. Do you
Yeah.
understand where I'm coming
Yeah.
from?
I understand
You know,
that. Yeah.
it would affect you more. It would make you so much more bitter.
Hmm.
And so, that's why I say I was blessed, because
Yeah.
actually it did happen, but it wasn't something that we brought down. I allowed it to affect me,
So,
you know.
so you didn't focus on the problem.
No,
The problem, whilst going through, you didn't even necessarily, you just knew that you had to make it through, but
that's
you
it.
didn't. And in hindsight, looking back, you can then reflect on it
Oh,
and
yeah.
say, okay, that's what had happened.
Yeah,
But so partly your personality helps you to overcome
yeah.
some of these challenges.
Yes, but these are foundations,
Hmm.
I always say you can't build a house on
Hmm.
something that's rocky.
Hmm.
I was blessed because my mum was great, you
Hmm.
know. She was a strong person. She had
Hmm.
come over from Liberia, Liberia, and flew straight into Liverpool, and thought
Hmm.
that she wasn't even in England because they weren't speaking the English, Queen's English that she was taught,
Yeah.
And so, you know, and she's always strived, and she faced a lot of racism. I mean, my mum was one of the first, uh, actually was the first Black lady to work in Marks and Spencer in Marble Arch. And
Right.
she, yes, she worked in the ladies' clothing department. And I remember her telling me things like when she goes to measure the ladies, and the ladies say, actually, I don't want this Black woman measuring me. She's dirty, you
Yeah.
know, and she faced a lot of that, you know,
Yeah.
and so she protected us,
Yeah.
you know, from having to go through what she went through.
Yeah.
Um, and, you know, when we would go to her with difficult stories, maybe in our life or a job interview and things like that, she would say, well, there's another way, you know, there's always more than one path. She always
That's
says,
right. Yeah.
always more than one path. If you're going to concentrate on just one path, that is always going to get you down.
Yeah.
Find another avenue,
Yeah.
because you can go around it, you can go over it, or you can go across. You must find another avenue. And so that's what we've always done. We crack our heads together and we try to come through and find another way of dealing with whatever the problem is. And this is where the foundations is. And this is why it's really important. I mean, it's a buzzword now with me. It's resilience, you
Yeah.
know?
Yeah.
And we need to teach the children resilience, understanding that things are not easy. And guess what? Those are the best things. The ones that you work really hard for are
Yeah.
actually the best things. Things are not going to just come to you. You've got to put in that effort. And we have to do a lot more.
Yeah.
We have to do a lot more, you know, and it's a shame we shouldn't have to. But once you know it and you know those challenges, at least you can meet it and be prepared. Because
Yeah.
going into battle unprepared,
Yeah.
you know, you'll be defeated. And
Yeah.
so it's always being strong in yourself and knowing who you are.
Hmm.
Those foundations are really important. It's
Yeah.
really important. It
Yeah.
builds character on somebody, it builds character on children, and they need that.
No, that's inspirational. I like that
Mhm.
idea that, you know what, you have to get through it,
Yeah,
right? There's always another way. It's not just, you're right to say that if you just become so transfixed and so focused on one thing, if you
mhm.
then don't get that, right, it's as though your whole world
Yeah,
has crumbled in front
yeah,
of you.
yeah,
And
yeah,
and that can, I suppose, lead to examples of mental breakdowns and
yeah.
examples of things not going the way that you had intended, and you not having an alternative pathway to travel
Yes,
down.
that's it.
Yeah. And your world collapses. But I do like the fact that you said about building that resilience, that
Hmm.
we have to build the resilience, and not just within ourselves, but in the next generation, in our
Yes,
children and
yes,
our children's children. Can,
definitely.
can you, you mentioned about, as a black woman, um, can, from a perspective of mental health, it always seems to me that there seems to be a lot of um, cases of mental health issues within the black community. From your experience on the front line, how does that translate? Would you agree with that statement, or how would you contextualize it for us?
In proportion, in some areas, there seems to be.
Hmm.
But actually, when you really dive down and you look at the stats, um, a lot of Black people don't go to the services.
Right.
They don't talk about their feelings.
Hmm.
We're not a talky, feely kind of culture,
Hmm.
which is a shame, because I feel that PTSD is real.
Hmm.
It's real in Black communities.
Hmm.
I mean, it's a buzzword now, but the trauma, one, we've got people that come over to this country in various ways. Sometimes they sell everything, or they risk their lives. How many people have risked their lives to come over here? That in itself causes PTSD.
Hmm.
Sometimes broken families causes PTSDs, because these all affect how we grow up. Um, our families sometimes are are disorganized, or you know, are well, they suffer, and they suffer for various reasons. It could be financially, not having the right education, not having the right support,
Hmm.
and so this all has an effect on a human being.
Hmm.
So this is where the saying comes from: you can't judge anybody if you haven't walked in their shoes.
Yeah.
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 And so, you know, unless you really understand, and when you look at the case by case, I mean, all the big cases, mental health cases, involving a lot of it is schizophrenia in relation to Black men. But actually, when you look at the history, you can see it coming.
Mm-hmm.
Broken family,
Mm-hmm.
and a lot of, you know, broken family, no other support network, going into foster care or just growing themselves up.
Mm-hmm.
So it's a broken family, but the child is the adult in the home that, you know, going to school, coming home, cooking the dinner, looking after the parents, or, you know, doing the shopping.
Mm-hmm.
Those things have an effect on that child. And so that child grows up thinking that's normal.
Mm-hmm.
And they don't talk about their feelings. And a lot of the things, sometimes what people are exposed to in their families also causes them distress. And these
Mm-hmm.
distress not talked about, they become the underlying. So it crumbles at the foundation.
Yeah.
And so when you grow up as an adult and you try to build a family on this,
You haven't.
you
Yeah.
haven't got good foundation.
Yeah.
So it
Yeah.
doesn't, it falls apart.
Yeah.
So these people don't learn how to cope. They don't learn about themselves. They don't understand who they are because they
Mm-hmm.
haven't really grown. They've just
Mm-hmm.
been, you know, we say that, dragged up.
Yeah. Yeah.
Yeah.
Yeah.
We say that
Yeah.
when that person is dragged up, it means they haven't got good foundation. And so
Yeah.
they don't react normally, that we would say normal,
Mm-hmm.
to a situation.
Mm-hmm.
But it's not their fault.
Yeah.
It's how they were dragged up,
Yeah.
you know?
Yeah.
And so
Yeah.
they don't respond properly. They don't go to the right people. And actually the professionals in health or anybody is seen as an alien, is
Mm-hmm.
seen as not wanted, is seen as interfering. And
Mm-hmm.
some families actually put that fear in
Mm-hmm.
them from childhood. You don't talk to these people.
Mm-hmm.
You keep our business to ourselves.
Mm-hmm.
Yeah. You don't
Mm-hmm.
bring in people into the home.
Mm-hmm.
You see how it
Yeah.
builds.
Yeah.
You hear it.
Yeah.
And then, so when they grow up as an adult and they're suffering, they don't go to the services.
Yeah.
So then their condition, underlying condition, becomes worse. And
Yeah.
when they're suffering, they self-soothe, but they don't know how to do it effectively or properly.
Yeah.
So what do they use? It's whatever their friend gives them.
Yeah.
Oh, try a bit of sleeping tablet. Oh, try a bit of marijuana. You know,
Yeah.
yeah, hang out with us, we're cool. And so
Yeah.
they pick the wrong things to
Yeah.
self-soothe.
Yeah.
And it's
Yeah.
only when, you know, things get worse, 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 and that's what happens. It gets
Yeah.
so bad, then the police have to intervene because one, they're a danger to themselves, as
Yeah.
I said, or a danger to others.
Yeah. Yeah.
Yeah,
I can see the cycle.
that's it.
There's a pattern, there's a cycle,
Constant.
which
Yes.
if that cycle isn't broken,
Yeah.
then it will continue from generation to generation to generation.
Yeah.
So having identified the problem, right? I'm not going to say have you got a solution, but have you got any hints and tips which you might for people who may be encountering that or who are feeling at the moment it may feel like just strip and an excessive amount of stress. What hints and tips would you give for helping? Or I put you on the spot here, but
Oh, no, it's okay. No, it's okay. I mean, look, these things, there's not one answer fits all, because that's the beauty of people. We are so different. And so different things work for different people. But first of all, the children, we need to teach them how to understand themselves and be. It's only when you're comfortable in your own skin. You know, I find that children nowadays are on TikTok, on Twitter, they're following that person, but they're forgetting, just love you. People don't love themselves and appreciate who they are and accept. It's only when you accept who you are that you become whole, you know, you're stronger because you're not swayed.
Yeah.
You know who you are, you accept yourself. And that's when I say you become a woman.
Yeah.
It's not age that gets you to a woman. You get to a woman because your mind is a mental state. Now, keeping ourselves, self-soothing is really important. But I think the first step for anybody is to understand themselves. Write down, recognize, actually, growing up, what really affects me? And it's a skill to learn to do that. But question yourself. Question why you have ended up the way you are. And then start to look at, what do I do to help that? You know, how can I help myself?
Yeah.
And actually, if you can't help yourself, there are people out there that can help you.
Yeah.
And so we have got a various, I mean, we live in England,
Mm-hmm.
you know, there's a charity for everything. And that's the beauty of it, you know.
Mm-hmm.
If you don't know, please ask, and please go on Google, find out what is in your local area, because every area is different. But, you know, we have got counselling services, and I know they're hard to get to at the moment, but, you know, go through the mental health sector. There's no taboo on it.
Mm-hmm.
You know, as I said, if you've got a mind, which is everybody's got a mind,
Mm-hmm.
that mind can always be upset or need help. And so there's no taboo on it. Go to your mental health sector. They can point you in those right directions.
Mm-hmm.
You've got bereavement counsellors, and then you can go more medical, which is the
Mm-hmm.
crisis team. People are
Yeah.
there. They come out to your home, or you can go to them. They can start looking at if you need medication or if you're not. You can speak to your GP. You know, there is services. Start looking after yourself. That's the one thing that somebody can do to self-soothe, is just to ask the question. There's no harm to ask a question.
I was just going to following up on that, and it's just something which was in one of the comments, which was about, in your opinion, is the service, are Black people, you know, like how within the COVID thing, there seems to be a disproportionate number of BAME individuals who seem to be affected. Is it that the service is letting us down? And I'm going to put that in relation to mental health. Do you think that the service is fit for purpose when it comes to understanding the issues of Black and other ethnic minorities?
No, it, it trying, but it's not fit. It's not, we're not there. There
Right.
is a lot of room for maneuver. And
Yeah.
so I can't sit here and say, yeah, we do wonderful things. No, we've got a long way to go to
Yeah.
reaching perfection. Because until people are woke and understand, actually not every raised voice in a Black person is aggressive,
Yeah.
and
Yeah.
actually let's listen to the content of what they're saying.
Yeah.
Let's not perceive the person. So where you have a Black person who is expressing themselves passionately, and you perceive it as an aggressive tone, then you know you have to challenge yourself there as in the individual. But shaping the service is what we're talking about. People are trying, and we've got a lot more BAME people within the service, not as much as we need,
Right.
because a lot of the time I sit on meetings and they're not my, you know, we're peers, but when you look around, people don't, they're not your peers because they don't get you.
Yeah.
They're not, you know,
Understand.
they haven't walked in your footsteps. They don't see that young Black boy as their son, you
Yeah.
know.
Yeah.
They don't see that young boy as your son and actually give them that extra 5 minutes to hear them. You know, there's listening and there's listening.
Yeah.
And so, you know, when people listen with their ears, they're not hearing them. I want them to listen with their ears and their mind,
Yeah.
and then put themselves in that shoe and say, we
What's
could do better here,
Yeah.
you know? You
Yeah.
know, so it's about that. But also, I don't think what's happening with the BAME and COVID is that a lot of BAME people work in the lower jobs.
Yeah.
Yeah? So they weren't furloughed. They weren't the ones
Yeah.
that were furloughed and are sitting
Yeah.
at home or have got the desk jobs so they can stay at home.
Yeah.
They're the porters. They're the, you know, some of those people are the nurses and the doctors. They're the ones doing the hands-on
Yeah.
jobs. They're not the medical directors who can just direct, you know, the service and
Mm-hmm.
come up with probably unrealistic targets. You
Yeah.
know, they're
Yeah.
not those, and that's why I believe that it's affecting them. And but yes, there is medical evidence to show that we are bigger. We do suffer from asthma and diabetes and those things. Those make us more susceptible when we get it and get severe.
Yeah.
But actually, we're exposed because we are the train drivers, the bus drivers, and
Yeah.
those things, and we know
Yeah.
that those people
Yeah.
have suffered a lot. And
Yeah.
also, you know, we were the ones that didn't believe in COVID. For like, you know, in fact, there
Yeah.
was rumors going on. If you just eat ginger and garlic, you know, our food protects us, and you know,
Yeah.
we're Black, we can't get it.
Yeah.
I'm sure I've said that myself, but you know, when you're ignorant,
Yeah.
when you're ignorant,
Yeah.
so there's those kind of things. But now, now people are understanding it, and we've got a long way to go regarding this disease.
Yeah.
We've got a long way to go because if we think about smallpox, it took 60 years to eradicate smallpox,
Yeah.
and so we're only year one into this.
Yeah.
So we've got a long way, and our lives will change, and our social lives will change, and
Yeah.
so we need to start waking up to this fact
Yeah.
that actually, until the vaccine is available to all,
Mm-hmm.
our lives will be disrupted for a good 2-3 years and
Yeah.
beyond.
So I'm just bringing this back then
Mm-hmm.
to the whole idea of the mental health and the mental well-being of the country, because I know that lockdown for a number of people has been traumatic for them, right? I had a conversation last night, and some of the things which it was kind of like, this has just been a nightmare, and how do you think that might impact the mental health services going forward? Or
Hugely.
have you seen an increase already, or
We're
what?
starting to see an increase already, but it will be huge. It's going to be huge. It's an underfunded service already.
Yeah.
And so even if we had the funding, it's under-resourced, and we wouldn't have enough counsellors to even help the people that need it.
Yeah.
The services have been sold out, and so it's really underfunded, and so it's scary. But you've got people who've been locked up for months. Their mental health is going to suffer. The loneliness, we say loneliness is the killer. Loneliness is really going to suffer. And if you could imagine, if you already have mental health issues, but you're just coping with it,
Mm-hmm.
by going to your community group, going to
Mm-hmm.
the gym, those
Mm-hmm.
kind of things, and then all of a sudden all of those are gone, what are you going to do? People are self-soothing,
Mm-hmm.
food, with drink,
Mm-hmm.
and so we're starting to see an increase on, you'll see an
Mm-hmm.
increase on alcoholism, you'll
Yeah.
see an increase on weight, you'll see an increase in babies.
Mm-hmm.
You're going
Mm-hmm.
to see a huge impact as a result of this. And
Mm-hmm.
people, you can talk about people, just the thought of going back into lockdown and not having their supportive bubble,
Yeah.
people that keep them well,
Yeah.
is going to really, really, really impact hugely on those people. And so it's really hard, but it's just being optimistic
Mm-hmm.
and coming up with a new plan, a
Yeah.
new way of coping.
Yeah. Yeah.
I mean, even for me, for me, it was really hard on me, and I was working.
Yeah.
But for me, being able to let my hair down, go out for a drink, or I love dancing, and so not being able to do any of that really
Yeah.
impacted on me.
Yeah.
But I can pull something from it. At the age of 46, I learned to ride a bike,
Fantastic.
and so I've now bought my first bike, and so you learn different ways of coping. You
Yeah.
just got to learn different ways, different things to do.
Yeah.
So yeah, everybody learn, get on a bike.
Guess like it. I'm a cyclist, so I
Oh yeah, I
endorse
know.
that. I endorse that definitely. Right. It's been fascinating talking, but I'm just wary of time. I'm gonna ask if anyone who's been listening, if they have a question which they would also like. I know that Clarissa, but I think she had to go. But is there anyone else who's got a question which they would like? If you want to either raise your hand or just come on mic, that would be brilliant. Is there any questions from the audience? Clarissa's one I tried to incorporate already. William.
Yeah. Hi. Thanks, Sarah. Yeah. Very, very interesting talk. I think there is some work that tells us that that racism, and I would kind of endorse it, is is certainly detrimental to well-being. So if you live in a institutionally racist society, for us to be sane as Black people, that's something good. You know what I mean? We must be achieving something. So to live in a society like this sometimes. But but my question, I suppose, is I wonder then, how can we promote good community well-being in the face of living in an institutionally racist society, and the traumas and the hostility that brings, trying to deal with those everyday microaggressions and ignorance. How can we promote a good community well-being?
For me personally, is keeping being woke. This is the perfect time for it. Not confronting, but just talking about it, always talking about it. And I see every opportunity as a learning opportunity. So people often shy away and go, oh, but no, actually, it's challenging it, but it's educating people and actually saying, as a community, this is not how we feel. This is how it should be viewed. This is how we like to be seen. This is how we like to be talked to. So we need to be embracing this. We need to be moving this on, but not silencing it. No more sweeping it under the rug. Let's keep it live. Let's keep it real. Let's keep it live. Let's keep it current, and let's keep it going, because that's how we're going to change everything. I mean, it's a bit like COVID, because if you hide away from it, it's like the 3 months they locked us down. But actually, as soon as you start opening the doors again, it's still there. So it shows us it didn't help, because to change anything, you need the emphasis of people. You need people to buy into it. You need people to understand it. You need people to cooperate with it. And so challenging racism is about people keeping it live, always talking about it, keeping it in the media, keeping it with our kids, letting our kids understand that it's not something to be put away and hidden away and think actually it doesn't exist anymore. Oh, things are all right now. It's always keeping it live, updating it, and always keeping it at the forefront of our mind, but not in an aggressive manner, but educating manner, always trying to, let me incite you. I'm trying to be insightful, educating, so that you can move people on, and embrace the culture. I love culture. I love knowing different people. Let's not keep to our communities all the time. Let's bring people into it. And we, as a culture, Black people love people. We love to socialize with people. So let's bring those people in, but not just being in there. Let's educate them about ourselves. And actually, when people know us, then, you make that difference, because they will teach their children. That's not how you view people. That's not how you view that person, and so that's the way of changing that community.
Definitely. I love that idea of keeping that conversation going, because sometimes what happens if that conversation, if people aren't talking about it, or there isn't an awareness, then things can quite quickly slip back to what they were before. Because
and they do, and they will. So we need to keep this going.
Definitely. I'm just wary of time. Is there any other questions from the floor?
Yeah, just quickly I put in. So you almost touched on it. So I wonder how I've been struggling how I'm going to kind of bring this up with my children, how I talk to them. I'd thought about the talk I'd have to give my children in the future, but now that I'm here, it's a very different situation. I'm lucky that where they are now, they're not encountering the same kind of racism that I was encountering when I was at school. They're actually in a very much more mixed society already. And as far as I've been made aware, there's no kind of any of the racism, the classic old school racism happening. And also, they're a slightly different background to me. They're interracial children, as I came up with parents that had immigrated over here. So I'm just wondering how best I can kind of broach the subject with my children.
This is something that's, I've got a young family, and so it's always been, it's a topic, how is your day? When you get back from school, how's your day? How did you find it? And things like that. But you also, if they don't bring up anything that you can build on, then you bring up, oh, I went through this. What do you think about that? This is what happened to me when I was growing up. What do you think that is? So that they understand, because what I was saying earlier was, I didn't even know that. It's only afterwards that I knew that was what was happening. So the kids they're sleeping at the moment, and in their minds, they don't recognize it, because naive kids. It's lovely to be that way. But if we don't equip them to recognizing these things and addressing it, addressing it in a positive way, because a lot of the times people do things and they don't see how it's going to affect that child, but it does. It does. Like comments, like I remember my daughter recently is supposed to be doing a higher paper in maths, and the teacher said, "Oh, we're going to do an exam in November, but most of you," which is a lot of cultured children in the classroom, most of you, you can keep your lower class revision books. Do you see? So he's already telling them they're going to fail. Yeah, they're going to fail, and so what faith are you putting him is those slight things, because he doesn't, I mean, I picked him up on it, he didn't even realize that's what he was doing. Do you see? So sometimes people are innocent, but actually it doesn't make it good. And so it's just enlightening your kids. Go through their day with them, bring up some of the stuff. If they don't bring it up, you bring up an example and debate it at the dinner table. These are good structures, those kind of conversations, those difficult conversations. Make your home where you can talk about those kind of things. You can talk about everyday things. They can bring their issues to your table, because when they ask their friends about it, it's not an informed conversation.
That's right.
Yeah.
That's right.
So, it's really, really important. Let your home, let that table, wherever, coffee table, wherever it is, that's your social gathering, let that be the foundation for those children. Build them up to be resilient, but to be wise and to be knowledgeable, so they can cope with the world that they're going in.
Thank you.
I was gonna, my famous last question is always, what advice would you give to your younger self? But I think after what you've just told us, I think I got a good idea of what you might tell your younger self. So, but Sarah, it's been fantastic having you on here this week. Really
Thank you.
It's been really insightful.
Yeah.
Looking at the whole idea of belonging within an environment where mental health, that all of us could potentially suffer from. I think
we do. That's the next debate. We all do. But we manage it.
Yeah, we manage it. I'm not sure if at the start of the conversation I was managing it too well, but hopefully I've self-soothed, right? As we've gone through. So Sarah, once again, I want to just say a big thank you for coming on. And we'll definitely continue this conversation.
Definitely. So thank you. But don't forget, World Mental Health Day tomorrow. Self-soothe, do something, enjoy yourself, but bring it to your families, bring it to your children. It's World Mental Health Day. And don't alienate the topic. Keep it live. Look after yourselves.
Brilliant. Thank you very much. Right. I'm going to just quickly share our screen for next week, which is going to be, we're going to have, hopefully this has come up. Next week, we will have Miss Karen Joash, who is the consultant obstetrician and gynecologist and was voted London Consultant of the Year 2019. It's going to be a fascinating story looking at another aspect of health and well-being for our Black History Month series of Belonging. So please tune in next week. And if you have missed any, you can always go to the YouTube channel with the tiny URL belonging hyphen AOL IAO Imperial as one. So if you want to tune into any of these, and Sarah's one will be on in a couple days time, hopefully. And so have a good week, and thank you once again for joining us. Stop sharing. Just 1 second.